Dr. Saag, about a year ago, we hit this point of a pandemic, the first case coming to Alabama. We knew that it was in the US a couple of weeks before that. But at this time last year, I'm sure you knew something was coming. How big did you think this was going to be? Did you think it was going to be as life-altering as it's become?
No, I did not. I'm chagrined to say that, but I remember vividly one of my patients who lives in LA called me frantic and said, roughly in mid-February, and said, "What's going on in China? Is this coming to America?" And I said, "I'm aware of what's going on in China, but I don't think it's going to leave the Asian Rim because that's where SARS-1 went. And I didn't have any sense that this particular coronavirus was going to be any different than its predecessor. In fact, I knew it was different genetically, but I didn't have as strong a sense that it was different epidemiologically in terms of transmission and in terms of virulence, meaning its ability to kill people." My my experience extended into the 1st of March, where I started to feel uncomfortable with that initial thought. I remember that I went to a large infectious disease meeting where we talk about HIV and hepatitis virus and other viruses. It's the premier meeting, and it occurred the first week of March of 2020. And for the 5 or 6 days prior to the meeting, there was a lot of buzz among the conference organizers about whether the meeting should be canceled. And they asked my opinion. I was involved with the organization peripherally. And I said, no, people can vote with their feet. We'll have the meeting. Those who are uncomfortable coming from Europe or coming from Asia could decide on their own, but we can have the meeting. On that Friday, I boarded a plane to go to Boston where the meeting was being held, with the understanding it was still going to be a live meeting starting on Sunday. By the time my plane touched down in Boston, they had canceled the meeting and decided to go virtual. And at that moment, when I got to the meeting area, I remember walking in and some colleagues had canceled who were supposed to come from Italy, and they described the horror of what was going on in Italy. And that was my precise moment of transition where I kind of recognized this is going to be bad. And I didn't know how bad, but I knew that my original concept was off.
When it did hit and things seem to have gotten pretty extreme pretty quickly. I feel like everybody went from living their normal lives one day, and then by Monday, it was a totally different world we were in. By that point, there were several people that said, 2 weeks, a month, I'll be out of here. It'll be back to normal. By that point, when we started going into lockdown, did you know that this was for the long haul?
Yes. In fact, continue my story. So we had the meeting virtually. It went off without a hitch. It was remarkable. In 48 hours, they went from a live, in-person, 3,500 individual meeting to a global virtual meeting before Zoom was ever popular, and pulled it off without a hitch. And I was very happy to be a part of that. I just helped with logistics. On that Thursday, the meeting was over on Wednesday. On that Thursday, I took a train from Boston to New York because I was going to drive back from New York to Birmingham with my son, who's a physician in Manhattan. And on the train ride from Boston to Birmingham, I penned an op-ed for AL.com. And originally, it was a letter to the governor saying, this is going to be bad, and please do this. And I sent the email to the media group at UAB, who immediately said, no, you can't write this as a letter to the governor. Just convert it to an op-ed and make it more generalized. So that's what I did, and it got published literally, I think that weekend on AL.com. I think it was Mike Oliver. Yeah, it was Mike Oliver, and I worked on it. He took it right away, and so it predicted this thing getting really bad really quick. So it was really just in a 10-day period, or maybe a little less, a 7-day period. I went from no big deal to, well, oh, this is going to be horrible. Couple of other anecdotal stories out of that, if that's okay.
Yeah.
Uh, by that Monday, I got there on a Friday. By that Monday, the stories coming out of Italy got even worse. And I remember seeing a picture sent to us from a colleague from Milan of a healthcare worker who was just prostrate on their desk in front of a computer screen in the hospital, exhausted after having worked well over 24 hours, no break, taking care of people dying. And their comment at the end was, not only was this exhausting, that they had every bed in the hospital filled and the ER continued to take patients in, and they started having to make decisions about whether to keep the 80-year-old in the ICU on the ventilator or take that 80-year-old, send them home, and make room for the 42-year-old who needed a ventilator. They were already at that point by the second week of March. And I thought, to quote the original Batman movie and the Prince soundtrack, I've seen the future and it will be, kept echoing in my head. And I thought to myself, we need to sound an alarm. So on that train ride from Boston to New York, I had a little feeling of being Paul Revere, that we needed to sound the alarm that the virus is coming. The virus is coming.
Is it something that we have done right that means we have not had to make that decision of who gets the ventilator, or is it sheer luck?
Luck. There's so much, there's a lot that we did do right, but there's so much we did wrong. And I just have to say the truth, and that is there are tens of thousands and maybe well over 100 to 200,000 people in the United States who died because our response was inadequate. And that's for the record.
Does that keep you up at night, thinking that people died because we were not prepared?
I'm very saddened by it. I'm angry about it. I feel like the people at UAB who I work with, myself included, my colleagues in the ID field, I think we can rest at night somewhat because we fought hard, very hard, to try to influence policy, to try to change our response as a country. And I think we were somewhat effective, but for every time our voice was heard, there was at least an equal number of tweets or emails or sound bites coming from some other location that negated what we were saying. That chaos, that confusion killed people. And I don't know why suddenly people in a political arena are suddenly experts in infectious diseases. I don't expect them for me to be an expert in financial policy or lawmaking. But I and my colleagues know about epidemics. We know about viruses and why our voices collectively were assassinated by public policy, by politicians, by social media is something that I think historians, sociologists, anthropologists will look back for 50 plus years and dissect, but it killed people.
Is it frustrating to you that you have spent decades of your career becoming an expert on infectious diseases, and you have spent years perfecting this knowledge, and you have these social media conspiracy theorists who want to just say crazy things, taking dog flea medicine, using horse tranquilizers, doing just crazy things? Does it frustrate you that you are trying to be a voice of reason and people don't listen?
It's very frustrating. And again, it's not just me. I think it's everyone, all of the colleagues I know, and you all over the country, all over the world, who found themselves in an echo chamber yelling into the wind and not having a lot of people listen, or worse, saying that we had some sort of political agenda or that we were trying to undermine the current administration, or that we had some reason that we wanted people to die to make ourselves feel more important, or that we were just making it up, that this wasn't true. People really weren't dying. We're making this up just to make the administration look bad. And the best way I can describe it is that when you put yourself in the shoes of someone who is in public health is no different than individual health, except it's just for more people. So the way that I approach an individual patient is I'm there to do an assessment, to try to figure out what's wrong, make a diagnosis. And once I have that reasonably worked out, then I transition to a therapy, a treatment. Every step along that way, I am trained, every doctor is trained to put the patient first, to think about the data in its raw form without prejudice, just saying, this is what's going on here, and this is the best we know to do for this. There's never the thought of, well, I'll increase the hospital stay if I make some other crazy diagnosis and do a bunch of extra tests, or it's going to look bad for me or the hospital if I make this diagnosis, so I'll make another diagnosis. That's antithetical. That's not just malpractice and ethically wrong. It's just flat out wrong. Nobody would ever do that, and it doesn't even enter our mind. Yet, when we apply those same principles, which is what we do, to the public or the public health, to the population, as if that population was an individual patient, we do the exact same thing. The rigor is the same. The approach is the same. The principles are the same. And what matters at every step of the way is the truth, as the best we can discern it. And yes, our understanding of what is true changes because new information comes in. The best example of that is masking. So I'll get back to my story. So after I got to New York, my son and I rented a car to bring his dog to Birmingham, and we're in a car together for 20 hours. And he works at a hospital, NYU hospital, is an internist, a hospitalist there. And so we're in the car together, windows rolled up, and we are assiduously wiping down all the surfaces. Why? Because based on SARS-1, we knew that's how that coronavirus was mostly transmitted. It did not get transmitted by aerosols. And so we extrapolated that it would be the same for SARS-2. In that car ride, I don't know how much virus I was exposed to, but my son, unbeknownst to me and him, was infected. And even though he had no symptoms in the car ride, he's breathing, I'm breathing, windows are up, I'm a dead duck. I mean, I'm going to get this. So when we pulled in the driveway, he said, I've not felt well the last couple hours. I think I might have a fever. And we looked at each other and said, shit, you've got coronavirus. And I thought, double shit. There's no way I've escaped this. And sure enough, within 24 hours, I started getting sick. He got well by Tuesday. We both got tested on Monday. We're both positive. And he got well by Tuesday. I did okay to Wednesday, and then I had a week of hell. But survived, never had to go to the hospital. My point is that we didn't know initially how this was transmitted. The infection, this particular one, was really only 2 to 3 months old. And as we learned more, we said, this is mostly spread through the air. The analogy that I use is the cartoon character Pigpen from the Peanuts cartoons, the one who never takes a bath and has a cloud around him. Yeah, that cloud is a coronavirus. And when you're around somebody who has this, you're breathing that in. If you're within 3 to 6 feet, You're going to breathe it. And the longer you're in contact with them, the higher the probability you're going to get it. If you're in a closed space and neither of you are wearing masks, you're going to get it. And that was discovered by around the later part of March and the first part of April. And what did we do? We changed our recommendations. We said, it's important now to wear a mask. We've learned how this is transmitted. Just like if I have a patient in the hospital and I thought they had lupus and I learned that they have an infected heart valve instead, I changed my diagnosis. Why? Because that's the truth. And it's going to do that patient harm for me to continue to treat them as if they have lupus when my new information discovers that they have infective endocarditis. So that's what happened. So how did that play out? What are the infectious disease community and most reasonable physicians? They embraced it and said, everyone should start wearing a mask. And to the haters on social media, they said, well, wait a minute, you just said 3 weeks ago that masks weren't important, and now you're saying they are important. You're not to be trusted. And this assassination of the trusted voice, ultimately, in my opinion, is what killed a lot of people, because the country didn't know who to listen to anymore. They went to the medical textbook, of Facebook medical textbook, and got their information there, and they still do. And they believe that that is where the truth emits from. And there is some truth on Facebook, but there's an awful lot of mistruth. And so what we have to relearn is how to trust the experts in the field. If we're going to war against Iraq, if we're going to war against Germany back in World War II, we didn't have people on the ground on Facebook, if it had existed then, second guessing Eisenhower or Schwarzkopf. We trusted the expert to manage the war. No one assassinated their expertise. And that's what happened to us.
Is this a war?
Absolutely. It's a war against a virus. It always has been. And the virus isn't clever or smart. It's just a virus. And it's all it wants to do is two things in life: survive and replicate. That's it. It's that simple. We know that. And our job, knowing that, is to mitigate it. Wearing masks, keeping distance, avoiding crowds where people aren't wearing masks, and getting vaccinated. That's how we stop this sucker. But unless we heed and work together, we aren't going to win the war. What would have happened in World War II if we had the country going in all directions? Frankly, if we had the leadership that we had in the 2020, and I don't mean that as a political statement, I mean that as a statement of fact. And when I would try to say that, I was careful because I work for UAB, and I don't want to get at odds with the governor or the lieutenant governor or any politician in the state or the country. But I throttled back my feelings that we were being pretty mismanaged in terms of our leadership then, because CDC was undercut. Tony Fauci was undercut. And those are the voices we needed to hear from. Those are the voices we normally listen to during an epidemic. And they were assassinated by the political systems, by the culture wars, by social media, and by people who thought they knew more than they really did. Stephen Hahn, for example, herd immunity through infection. That's criminal.
With all of these things, with the misinformation, the conspiracy theories, with everything, what is it meant to be we'll call it an average, even though they're not average, but just a ordinary nurse, doctor, respiratory therapist, hospitalist, janitor in the hospital? What is it meant for these everyday people who are just trying to go to work and do their jobs in the hospital or in a healthcare setting?
I'll use the war analogy. They're the soldiers. They're the people in the trenches. They're in hand-to-hand combat every day with the virus, trying to save lives of other people around them. And especially in the early days, putting themselves in harm's way. They didn't question whether they should be there. They didn't say, I can't go in because I'm worried about me becoming infected. Just like a firefighter doesn't refuse to charge into a fire to save somebody's life. It's what their job is. It's their professionalism. And every one of the healthcare workers, not just in Alabama, but around the country, around the world, they had that in common. They still have that in common. And they will do it again and again and again because they are professionals. And they not only did their job in terms of assessing people, giving their best assessment of what would keep this person alive and get them home to their loved ones, they did it without thought too much about their own safety. They put the patient's outcome above their own safety potentially. The country did pretty well in providing PPE, protective equipment, but they went in there every day. And the hardest thing that I think, not just for the families, obviously, and for the patients, but for the healthcare workers, what made this especially difficult was that you see people getting sick, you run out of things that you can do for them, it becomes futile, you know they're going to die, and they die alone. And the family's upset, and the patient knows what's going on, and they feel isolated and lonely. And I don't even want to begin to imagine what that feels like as a person dying, to know that their family can't be with them except maybe on FaceTime. And the healthcare worker, despite everything else they're doing that I've already mentioned, is the conduit. So in addition to being trying to be a healer in terms of a medical sense, they found themselves being chaplains and priests and ministers and rabbis and comforters. And during all that, the question comes up, who comforts them? And it's not just one day. It's day after day after day after day after week after month. And a lot of times with no vacation. And just like everybody else, they're suffering with the isolation caused by the lockdowns and not going out and being social. It was horrific. It still is. And so now you put that in the context of the misinformation and the mistruths and the misstatements and the poor leadership, and you know you're in this war and you're not getting the support, certainly not emotionally, if not just in terms of pure public health, and you're fighting two fronts. You're fighting the virus and you're fighting the system. That should never be allowed to happen ever again.
These healthcare workers that are on the front lines, I'm sure that this has gone over in medical school, in nursing school, in all types of medical professional education. But so many of them, I'm sure, never believe it's really going to happen, never believe they're really going to be on the front lines caring for a pandemic. What do you think about that? Do you think that statement is right? Do you think they prepared for this, or do you think that they were just as surprised as everybody else?
It depends on their background and how they were trained and what they focus on. For people in ID, most of us got the training in this, at least hypothetically. What if the influenza virus goes crazy, or what if Ebola comes to the United States, or a number of things. And despite our training, I think this still blew us away. And for the, I'll call it non-ID healthcare professionals, no, they maybe imagined it watching Outbreak, the movie, or something like that. But no, who would ever think about this is an imponderable? And even if you could imagine it, the depth of it, the day-to-day reality of it could not be imagined. But it does remind me a lot of the early days of AIDS, when a shunned population of people were coming in on death's door and there wasn't much we could do for them. And in that case, society, in a number of ways, at least in the US, shunned them and stigmatized them. And the healthcare workers found some degree of purpose and service by helping the people get through a very tough illness by focusing on not only their health care, but also on their personal care and their spiritual lives and helping their family deal with it. So that type of thing I'd seen before.
Like you said, they had to become chaplains, priests, IT professionals to connect loved ones when they are dying to their families. And oftentimes, as you said, they weren't even appreciated for that work. What can we do? What can we as a non-medical population do for our healthcare workers that shows the appreciation that we have for them?
I appreciate the question. I'd love to say, send them a bagel. I don't know. I'm teasing. Um, what I'd like to see everyone do is get behind the effort, trust the experts. They're not always going to be right, but at least we have a shot listening to people who know what they're talking about, as opposed to listening to people who don't know what they're talking about with conspiracy theories and a lot of other misinformation. That's the most demoralizing thing to me personally, and I think to most healthcare providers. We're not saying we're God's gift to the topic. What I am saying is that we've had training in this. This is what we do for a living. This is our expertise. We're not always going to be right, but I think we can and should be trusted.
Is 2021 going to be any better?
Yes. 2021, well, let's look at it this way. We hit a dichotomous fork in the road in December of 2020. The vaccines were shown to work. I'd ask everyone to think about what would have happened if those vaccines had failed. What if they didn't work? Where would we be right now in February of 2021? We'd be in a worse position than ever, because all the fatigue, not just forget healthcare workers for a minute, just for all of us, the fatigue of staying indoors, avoiding crowds, watching everything get turned upside down in sports or in entertainment or just in restaurants and bars, and socialization would have continued on and on and on with no end in sight. That's what we would have seen. But instead, in December 2020, through the application of science by experts like Tony Fauci, like the National Vaccine Center, who in 2 days after the sequence was released to the world on January 10th, 2020, 2 days later, Fauci and his group had a candidate vaccine. 2 days. Within 7 days, they had constructed it. In less than a month, they started testing it in animals. That is the Moderna vaccine that we use today. That was done by Tony Fauci and his group. So December 2020, I was hoping for a 50% protection. That's what pretty much influenza vaccine does. 60% I would have said was a home run. We saw 94 to 95% protection against symptoms. Unheard of. To use Greek tragedy terminology, a deus ex machina, which means that the gods came in and rescued the protagonist out of the bad situation before they got killed by the bad guys. We had a deus ex machina, a Christmas miracle. So 2021, we're going to celebrate science. We're going to celebrate our scientific leaders. We're going to celebrate ingenuity that is able to produce this. And while I've been harsh on the last administration, I will give them credit for allowing this to move forward, and I will give them credit for allocating funding to the companies developing the vaccine before they knew it would work, to build the plants to start producing the vaccines just in case it did. That was brilliant, and that was important. So I'm not going to be all negative about the last administration. There's some things they got right. But because they did that, we didn't have to wait the usual 6 months to a year after the vaccine would be shown to work, because you have to build the plants. It's a huge investment. And the companies aren't going to do that on their own unless they know it's going to be worth it. But they did, because our government paid for the plant development and paid for it, so that when December came and it hit, product was on in people's hands and in people's arms within days after the approval. That would not have happened but for that investment by our government. So to people who say the government doesn't do anything for me, think again. It does an awful lot for us that we take for granted. So 2021, we're going to see rollout of the vaccine. Right now, there's clamoring for it. People are frustrated, can't get it. They really want it. In 2 to 3 months, there'll be ample supply. Most people who want a vaccine will get it. And my prediction, by May to June, we're going to flip from a supply side problem to a demand problem, meaning the people who want to get the vaccine will have had it, and we're going to start having to focus our attention to people who are hesitant to get the vaccine, who don't trust the vaccine, who are fearful of the vaccine, and work with them to try to understand that the vaccine actually is remarkably effective and remarkably safe. We now have vaccinated well over, I think it's 47 million people have received at least one dose. We're not seeing anything different in the side effect profile. In fact, it looks safer even than it appeared to be initially. Israel has almost vaccinated their entire country, and their numbers have plummeted to remarkable levels. So this is our miracle. This is our Christmas miracle from last year. And if we do this right in 2021, Thanksgiving and Christmas next year will be normal in the United States, or at least close to normal.
Are we going to get to go to football games this fall? Are we going to get to go to the beach this fall? Are we going to get to have our Thanksgiving not outside?
Yes, I think we will on all the above. I think schools will return towards normal functioning. We won't be 100% normal. To quote the play from 2008 or so, we'll be next to normal. We will find a way to manage. We still might be avoiding huge crowds, or we still might be wearing masks. That's okay. We can get used to that. Wouldn't it be the small price to pay for admission to a large event to say, yeah, you still got to wear your mask? Okay, we can do that. Let's celebrate with a mask on, because we're now dealing with the variants. I think a lot's being made of that, but the variants are something to manage, not something to be afraid of. And what it's going to mean is that we just can't let our guard down. We got to keep vigilant. We got to keep ready. To the credit of the companies and to our government, again, we're already working on vaccines right now that'll work against the variants. We're right now working on answering the question, can kids under the age of 16 be vaccinated? That answer will come out probably in April, May, and the answer I'm almost certain will be yes. So we'll start vaccinating everyone, including young people, and we'll win this war against the virus. But we had a tough go last time. Last year was rough. And it was rough because we tried to fight this virus by fighting ourselves. And that's no kind of way to win a war.
What are you going to do first when things get a little closer to normal?
I suspect that what I'll do is just kind of celebrate. I'll just revel in the fact that we beat this sucker. And it would probably be getting together with friends again and just having human contact, going back to work and just bumping into folks around the water cooler or the coffee pot or in the hallway. That's where the best exchange of information, that's where we feel like human beings again. And yeah, a couple of sidebars are going to be coming out of this that I think are positive. I think in addition to the face-to-face, it's critical for us as human beings to be social. That will return. I'll engage in that in a big way. But I also found a silver lining that there are several things that I used to take a day and a half to travel somewhere for a 2-hour meeting and travel back. That's a lot of time in airports, on airplanes, and hotels. And yeah, the restaurants are fun. And maybe catch a show at a theater in New York on my day there. Yeah, I did that a lot. But I found that just a 1-hour Zoom can save me the travel. And that's not going to be the case all the time, but at least now I know that's an option. And I could give a talk or a grand rounds to someplace outside of Birmingham without necessarily having to get up and go someplace. And I think that's a benefit. I think we also learned a lot about telemedicine, that there are certain times when it is okay, maybe preferable, to have a one-on-one exchange with a patient without having them come in for a visit. But there's nothing like the one-on-one in person. I can put my hand out. I can shake your hand. I can hit you on the shoulder. I can give you a hug. I do that a lot with my patients in my clinics because it shows that I care about them. And that's critical. But just the human touch, the human interaction, the reading of nonverbal cues, which we all do subconsciously. And as a provider, I focus on that. Did that person glance down as they told me that? What are they trying to say to me? Those types of things are critical to being a good physician and just to interacting with people in general.
And I guess too, that one other silver lining we have is that there's been this interesting collective that we're all in this together and we all have that shared sense of experience here. And I think that that is one thing I do hope that we can take out of this, that understanding of each other, that grace that we have, most of us have been able to give each other. It's always a few outliers, but most of us.
Well, I agree. And as much as I've vented my spleen here in terms of a lot of the challenges that we've been up against, I say that mostly so that we don't ever make those same mistakes again, and that we do approach future wars of all sorts united as opposed to divided. I'm from Kentucky. It's a commonwealth, and its motto is United We Stand. And that's us. That should be us, the U.S. And hopefully we can do that from this point forward.